I have a family that was introduced during the August meeting that actually had to move to Colorado in order to gain safe access. This Byrd family has actually, that is their last name, the Byrds. They were introduced by House Representative Stacy during the August meeting, and shortly after it, at the end of October, had to move to Colorado in order to gain safe access for their child, Charlie Byrd. And I would like to just take one more minute of your time so that his father can explain the medical benefits that his son has received after moving to another state, uprooting his family, and actually, moving to another state to receive this safe, effective form of treatment. Can we take one more minute of your time, sir?
Just one.
Okay.
Thank you very much. I will be brief, because I'm cried after listening to what she said. This is the choice we have in Kentucky, to leave our family, our churches, our careers, to leave a life I've known for 35 years. I chose to do that. Other families here will choose to do that if you do not pass these laws to allow medicinal cannabis. And I know it works. My son went from 30 seizures a week. These seizures would last 40, 60 seconds on average. When we go to status events, we were in there for 20 to 30 minutes in an ER. Flown from West Liberty, Kentucky, to University of Kentucky, to Cosair in Louisville, to Cabell Huntington in West Virginia, to Vanderbilt in Tennessee, to Memphis in Tennessee. I've been to them all. We've been to neurologist after neurologist. Nothing has worked. 10 different medicines, most of which Jill listed. None of them worked. There's not one medicine that we give to our child that's approved by the FDA for pediatric use. One of his best medicines that we get from France. It's not even FDA approved in this country. Through the Compassionate Use Act, we're allowed to get that through his hospital. None of these treatments worked. Since we've been in Colorado, his seizures, as I said, went from, on average, 20 to 30 a week. We're seeing about 10. His seizures that were lasting 40 to 60 seconds on average, but upward in the minutes, we're seeing about 5 to 10 second seizures. We are at 50% therapeutic level, so we've got some way to go. And when you're talking about a dosage that Mr. Stanley mentioned, this is what you're talking about. A 1 milliliter syringe, this is empty by the way, 1 milliliter syringe, I give my son Charlie 2/10 of a milliliter. You're talking just a few drops underneath his tongue 3 times a day. That's all he gets. Since doing this, the seizures have decreased. But more importantly for us, as parents, the cognitive development. He looks me in the eyes. When he talks. He don't just blubber. He actually communicates with us. A parent that has never known the joy of that is amazing. To see your child actually communicate, like I said, mine's 5. He's probably about a 2 to 3 year old level because of his developmental delays. But to see his eye contact now, his focus, his fine motor skills have improved, his balance has improved, his gait has improved. Every cognitive development delay, he's improved it. And the seizures are getting controlled. They're not there yet.